What's up, my friends? Dr. Boyd here, and welcome to the Modern Medicine Matters. So, on this podcast, we talk about we talk about real stuff, is what we talk about. Just putting it out there, absolutely real, unfiltered, and particularly when it comes to your health. So, today's topic is this: your health. It's already your health. It's already been stolen. Sit back and relax, because here we go. So, if you watch the news, there's this constant berate that's there. And it's something, it occurred to me, especially like you see it around like times of political campaigns. You see it, especially like you can watch the patterns. If you watch the evening news on a regular basis, you kind of see these patterns, right? And there are these patterns of like catastrophe, 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 somewhat feel good. And then if it's a really slow news day, puppies. I'm not kidding. So if you can Google this if you want, it's fine. Like you'll see for ratings, news channels, like we're talking like national news, I guess probably local news does it too. If it's a slow news day, they're going to end with a story about a dog. Or if it's like a bunch of shit happening in the world and it's like everything's burning down and going crazy, I promise you there's going to be a dog story. Now that I said it, you're going to be looking for it. And when you see it, you're going to be like, oh my God, he was right. Like it's always something like a soldier comes home and like the dog that they hadn't seen that was like, clearing mines or something with them. They're reunited, which is great. I mean, that's a wonderful thing. Or it's like, like whatever, a drug sniffing dog that it's their retirement or something to that effect, right? There's always going to be a dog story at the end of a slow news day. But the important part isn't so much the dogs, the pattern and exposing that pattern. Because here's the thing that most people don't understand. And I don't know, the video might get censored for me even saying the word COVID. But the gift that came in 2020 is the curtain got peeled back just a little bit. Like the shit show that you saw, that was just it being peeled back just a little bit for you to see really what healthcare in the United States is like. And it's an absolute mess. Like it blows my mind that we are the same country that put people on the moon back in the 1960s, yet we are at the bottom of the world when it comes to healthcare here in 2022. Let me rephrase that. Before cell phones, we were able to put two people in a modified garbage can, strap a rocket to it, put it on the freaking moon. Yet we can't figure out how to take care of our own people here in 2022. If that doesn't piss you off, man, I don't know. I don't know what to tell you. It should piss you off. Pisses me off. So those of you who haven't tuned in before or don't know me, so my name's Dr. David Boyd. I'm an actual physician. Like I'm an actual medical doctor. I've been so for damn near 13 years now. And you name it in medicine, I've pretty much done it. When it comes to my background is primary care and truly primary, meaning that I've taken care of folks in clinics, in prisons, in the hospital, in the intensive care unit, in the emergency room. I've delivered over 200 babies. I've held the hand of countless people as they were dying. I've seen it and I've done it all when it comes to medicine. And the part I love about medicine is taking care of people. Part I love about medicine is in their most vulnerable time, be able to establish that connection with them and to help, not always save. Can't save everybody. I've had that lesson served to me by God over and over and over again. But to help. And 3 years ago, I decided I was walking away. That I wasn't going to partake in this sick game anymore. As I was taking care of people in the hospital, it occurred to me. This is sick care is what it is. It's not health care. There's no health involved. This is sick care. This is waiting. waiting for people to get sick. And there's tremendous profit to it. Oh my God, trillions and trillions of dollars. Now, here's the thing: most people like look at doctors. Oh, doctors must be rich. Yep. Well, doctors do okay. But all the sacrifices that I made, all the times I didn't see my kids as they were growing up, you can't put a price tag on that. Furthermore, that's not where the money is. That's not where the money's at, man. The money's with insurance companies. You know, the money that comes out of your check every month, that's where the money's going. You look at these like $600 or $700, $1,200, $2,000 for some families. And what do you do with that? Like, what do you get for that money? Freaking nothing. Even when you go to the doctor's office for your like once a year physical, where you're in and out in 7 minutes in a completely lackluster setting, kind of like standing in line at Walmart, you still pay a copay on top of that. And if you're like, no, thanks, I don't want to pay copays, they're like, no problem. We're going to up the premium. What do you get for your money? Nothing. Absolutely nothing. And then instead, you're constantly chasing, oh, I don't know if I hit my deductible. Oh, it's almost the end of the year. Quick, let's try to get as many things in as we can. It's a game. It's a game, and they got you. Your health has already been stolen from you. You don't know it. You got a little peek behind the curtain in 2020. I'm not sitting here like debating vaccines or COVID or this or that. None of that bullshit. It's more along the lines, you take a look at the actual system itself, and the system sucks. The system, you're right in the middle of it. The system doesn't give a damn about you. You're a cash cow. Do you remember the Matrix? Remember the movie The Matrix? Where like people are plugged in and their batteries just having the life like sucked right out of them? That's exactly what the healthcare system does to everybody. It is the great in-between. It is the greatest middleman that was ever invented. It is the greatest business show, like shell game, that's ever been created. And it's right in front of us. And most people never stop to think about it. And they just go work their 9 to 5. They get their paycheck. Money's taken out of the paycheck. Companies will kick you off a little HSA, a little health savings account. Say, there you go. You feel like you got something for that. You got a little tax deferral, and that's it. And you hope you never use it, and the money's just gone. Siphoned away. Here's a sick thing. God forbid you ever need to use it. Oh, the dance. Oh, the circus that will happen then. Do you know how many medical directors of health insurance companies I've been on the phone with? Let me tell you what a medical director is. So this is a physician that has sold out to one of these insurance companies, that has completely gone against their Hippocratic oath. And they literally sit there like a hockey goalie, like trying to slap away claims as they're coming in. Like, nope, you don't need that scan. Nope. Oh, nope, you don't need that medication. You don't need that. To try to save the insurance company money. So these medical directors do. I used to be polite to these assholes. Then I got to a point where I was like, I'm going to call you out for what it is. And I got vicious. I remember the last one I spoke to before I walked away from the traditional system. And I did. I lost my cool. I completely berated this guy. I was like, do you realize? How do you go to bed at night, sir? Knowing that you've completely gone against the oath that you've taken to do no harm. Knowing that you're suckling at the rotten teat of this insurance company. Like, how do you live with yourself, really? How do you like brush your teeth every morning and look at yourself in the mirror? Because you make a mid 6-figure salary? That's how you justify this? I got no answer. Eventually just hung up. I hope I made an impact. I doubt that I did for somebody like that. But for you, I put this out there for you. For you, I hope you're astonished. For you, I hope your eyes are open just a little bit. For you, I hope you can see just a little bit of really what's out there. Because of the fact of the matter is, the show that you all see, your civil liberties, our civil liberties, are slowly being taken away from us, little by little. You have this great distraction going on, politics, stuff going on in news, who took that from what office, all this stuff. That's the show. That's the circus, so that you don't see what's really going on behind the scenes. 99% of the time, people don't think about their health until they lose it. The reality is, people want to spend pennies for prevention, but they would give their life savings for the cure. You don't believe me? Go to your closest cancer center, like a big cancer center, like a big cancer hospital. Almost all of them have RV hookups behind the center. Almost all of them. Why? For vacationers? No. For folks that have had to go and sell their homes and go buy an RV, where life is reduced to walking from the RV to the cancer center and back till they're dead. Till they're dead. Why? Because there wasn't health care. There's just sick care. Health insurance companies don't make money by you being healthy. They also don't make money by you being dead. They make money by you being sick. Last thing I'm going to say. You see ads and ads and ads. Take this supplement. Don't listen to your doctor. You don't need these medications. You need this product instead. Understand that if there's something that sounds that it's too good to be true, it's because you're being sold to. I'm not selling you anything right now. I've got nothing to sell you. I'm just putting out knowledge, experience, education. That's it. I ask nothing of you. My name is Dr. David Boyd. I take care of some of the healthiest and wealthiest entrepreneurs in the world. Why do I do it? Because entrepreneurs change the world. The government doesn't. Organizations don't. Entrepreneurs do. They create services and businesses to actually make an impact and to make a change. Every product that you have that you use, the computer that you're watching this on or the smartphone that you're watching this on, was made by an entrepreneur. Wouldn't exist without it. So I pivoted my practice to take care of entrepreneurs exclusively. So I've got nothing to sell you. What I will ask you is this: open your eyes, question things, and ultimately advocate for yourself. That's what I've got for you today, my friends. I hope you find this helpful. I'd ask you two things. If you do, number one, hit the like button. Number two, hit the subscription button. Number three, share it. Share it with other like-minded people that are sick and tired of having their civil liberties stepped upon, sick and tired of having their health care taken from them, and sick and tired of this game that we're living in right now. You and I can take it back, but only if we work together. If you want to know more about what I do, you can go to blindspotmedical.com. I'm not taking any new patients right now, but you can see more of what I'm talking about. Last and not least, be back to you again soon and appreciate your time. Remember, health is wealth. Invest in yourself. I'm Dr. Boyd.